Hello, everybody. Welcome back to day 3 of the One Day, One Disease, One System series. तो इसके पहले हमने ऑलरेडी रीनल एंड पल्मोनरी सिस्टम कवर करे थे. आज हम हेमेटोलॉजिकल सिस्टम यानी कि ब्लड कवर करेंगे. पूरी चीजें, एवरीथिंग राइट फ्रॉम द एनाटॉमी, फिजियोलॉजी, पैथोफिजियोलॉजी, डायग्नोसिस एंड थेराप्यूटिक्स. So whenever I talk about the hematological system, it consists of the cells and the bone marrow. Myeloma, right? The cancer of the bone marrow, the blood, leukemia, cancer of the blood. So bone marrow is very, very important because myeloblast, lymphoblast, कोई भी progenitor cells हो गए उससे furthermore RBCs, WBC, platelets are being formed from this bone marrow itself. Then you have the spleen, which acts as a filter. It's called as a graveyard of RBCs. Then the hematogenous spread is very concomitant to lymphatogenous spread, like primary lymphoid organs, secondary lymphoid organs, MALT, GALT, spleen, right? All of these. So the cellular workflows, obviously, the most common diagnostic marker is the blood tests. So RBC, WBC, platelets, right? All of these in WBC, acidophils, basophils, neutrophils, lymphocytes, monocytes. Then you have packed cell volume, PCV, MCHC, mean cell hemoglobin concentration, and mean cell hemoglobin, hematocrit, ESR, erythrocyte sedimentation rate, the other blood markers like the urea, electrolyte level measurement, creatinine, right? You measure all of these in the blood. So plasma is blood minus the clotting factors, and serum is plasma. And you must know the difference between a blood plasma and a serum because people most of the time don't know the difference. They own blood minus the cells is plasma, and plasma minus the clotting factors is the serum. So that must be at the tip of your tongue. That must be at the tip of your tongue. All right. Then you have the hemostasis, which is a process of blood clotting or blood coagulation. इसको बोलते हैं hemostasis. When there's blood clot or blood coagulation. Hemostasis. So the defense system, WBCs में you have neutrophils, that bacterial, so acute inflammation होगा, neutrophils का count धड़ाक से बढ़ जाता है. Lymphocytes and monocytes 48 hours के बाद इनका level बढ़ता है approximately 2 to 3 days में. So lymphocytes and monocytes are like a chronic inflammation markers. Eosinophils, allergic and parasitic inflammation. Basophils आपका hypersensitivity response and reactions में involve है. So hematopoiesis is a process in which एक pluripotent stem cell होता है जिसका एक lymphoid progenitor होता है और एक myeloid. Lymphoid आपका lymphoblast and B and T lymphocytes. B lymphocytes आपका antibody mediated humoral immunity के लिए है. T lymphocytes आपका cellular immunity. Helper T, killer T, memory T, suppressor T, right? Myeloid आपका erythrocyte WRBCs 120 days की life cycle है. Megakaryocytes platelets, that is thrombocytes, 7 to 8 days lifespan. Myeloblasts, where you have granulocytes, including the neutrophils, basophils, eosinophils, and monoblast, which includes monocytes. Correct? So these are the myeloid and lymphoid lineage and progenitor cells. Similarly, you have pluripotent stem cells, embryonic stem cells, induced pluripotent stem cells. Correct? अलग-अलग type के stem cells आते हैं. So blood is very significant. Blood is a fluid liquid connective tissue जो mesodermal in origin होता है, 37 degrees होता है, and pH of around 6.35 to 7.35 to 7.45 होता है blood का. Right? So the pathophysiology, the RBC disorders mostly involve when there's decrease in the RBCs, hemolytic anemia, and when there's excessive RBCs, polycythemia. Similarly, WBC, leukopenia when there's decrease, and leukocytosis when there's increase. In the malignancies, leukemia. Blood coagulation, if it is a bleeding disorder, hemophilia and all, decrease in the blood clotting factors, and there is thrombus or embolus found, excessive failure of the blood to flow. Thrombocytopenia, there's decrease in the platelets. Thrombocytosis, there's increase in the platelets. So anemia occurs because of iron deficiency, vitamin deficiency, B12, B9, because of the different other deficiencies like microcytic anemia, macrocytic anemia, when the shape of the RBCs, morphology is changed, hyperchromic. So you check the total iron binding capacity, the ferritin levels. Mostly in iron deficiency, there's low ferritin and high TIBCs. Low ferritin and the high TIBCs is observed in anemia. So mostly the blood tests are the most common. Then you have the D dimer, CRP, and all for inflammatory test markers, right? So many times there is drug-induced hemolytic anemia, G6PD deficiency, like the chloroquine. Many times the sickle cell anemia because of the sickle cell of the RBCs. Many times autoimmune diseases are also responsible for this anemic conditions. All right. So acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, chronic lymphocytic leukemia. So these acute one is rapid, but lesser severity. Chronic is a slow but highly severe. So in this case, either the bone marrow transplant or the targeted therapy works, like the imatinib and all that acts on the tyrosine kinase. Then you have Hodgkin's and non-Hodgkin's lymphoma, in which lymphadenopathy, lymphadenitis is common seen, swelling of the lymph nodes, night sweats, and also you have Reed-Steinberg cells, which are common markers for the carcinogenesis. So the thrombotic risk involves disseminated intravascular coagulation, deep venous thrombosis, and pulmonary embolism, while in the bleeding risk may involve purpura and the thrombocytopenia-like conditions, and also Van Willebrand disease, in which the Van Willebrand factor is being disrupted. So either ferritin, total ion binding capacity for the coagulation, international normalized ratio. Higher the INR, higher is the anticoagulant activity. Prothrombin type, activated partial thromboplastin time. Checking the B9 and B12 levels, folic acid and cyanocobalamin. Checking the smear test, any visual inspection for the histology, CBCs, right? And invasive, like you have the biopsy of the bone marrow, BMA, bone marrow aspiration. So for the treatment, you give plasma volume expanders, decrystalloids, colloids like dextran and all saline, or you give hematinics, ferrous sulfate, ferrous fumarate, ferrous gluconate. There are certain transfusion medicines in which you fresh frozen plasma is being transfused, or cryoprecipitates, or packed RBCs, like resealed erythrocytes and all. Anticoagulants like oral anticoagulants, directly acting oral anticoagulants like warfarin, heparin, and all. So they are very commonly useful. So the key, in this series, I'm going to tell you the different diseases, their diagnosis, their biomarkers, their treatment, and the therapeutics, right? What can be given. So please do show love to the series, in which you will be having every system covered for the 12 days. So we have already covered the first system, pulmonary, respiratory, the second system, renal, urinary, the third, hematology. The next system that we are going to cover is the musculoskeletal system, bone, tendon, ligaments, skeletal systems, cartilages, all of those. So stay connected for and updated for more such upcoming informative videos. Thank you so much, everybody.